What happens if we have a positive biopsy? Which is characteristic of Sjögren syndrome, but everything else is negative. That is, everything else refers to serology and clinical symptoms. We have nothing else, just a positive biopsy. Remember that for a patient to be included in the classification criteria, they needed to have a dryness symptom, either oral or ocular, or a suspected systemic manifestation, which was what was present in the STI. In our case, we don't have any of that. No clinical symptoms, no systemic manifestations, nor do we have any serology results. We only have the biopsy, which gives us 3 points. But what do we do when, like we typically teach, what do we do when we only have the biopsy? Well, we need to consider other causes that could explain an abnormality at this level. And I've broken it down a bit, depending on whether there's a unilateral involvement of the gland or a bilateral one. If it's a unilateral case, then an acute cause could be a bacterial infection, actinomycosis, or an obstructive condition. If it progresses to a chronic condition, consider chronic sialadenitis or neoplastic involvement like adenocarcinoma or lymphoma. If there is bilateral involvement, especially viral infections. In chronic cases, consider HIV, hepatitis C virus, IgG4-related disease, amyloidosis, and granulomatous diseases like sarcoidosis and tuberculosis. But also in patients with hyperlipidemia, diabetes, or those who consume alcohol. Alcoholism also affects the gland, as do conditions like malnutrition, acromegaly, anorexia, and bulimia. This is the little table I showed earlier, the typical one from Sjögren, but as we can see, there are also various other factors that can cause changes at this level, such as age and smoking. Different medications as well. For example, here we see beta blockers as well as neuroleptic drugs used in psychiatry. And then the other conditions I mentioned, like IgG4-related disease, and sarcoidosis and amyloidosis. So then, what happens if we have a positive lip biopsy and everything else is negative? Well, we need to rule out other causes.